Welcome. You're listening to Under the Surface, a podcast where we have in-depth discussions on computer-aided techniques in drug discovery. Welcome, everybody, to this next episode of Under the Surface. I'm the host, Chris Williams. I'm here with my co-host, Dave Thompson.
Hey, Chris.
And we're here at the Montreal UGM 2024, and our esteemed guest is Arjit Basu.
Hi, Chris.
Who just gave a talk on how to assassinate molecules, amongst other things. So we're going to talk to Ajit about his role in drug discovery and your history and what you do, where you came from, and why you're here.
Thanks, Chris. Looking forward to it. I'm Arjit Basu. I work for Tenet Pharmaceuticals, and whatever I'm talking today about in the podcast is my opinion and not the opinion of Takeda.
So your talk was you came up saying you're the guy that the med chemists hate. Because, well, they're getting to like you, but they come up with a molecule and you kill it.
Yes. To be honest, we like to kill molecules as a computational chemist working in toxicology. But if we kill a molecule early, so we save so much money, right? Taking a molecule that has a liability forward, right? So that is why we call ourselves molecule killers. But in fact, what we do is we guide the molecular discovery through to a stage that are more likely to succeed because of safety endpoints. Mm-hmm. So that is what we try to do through the molecular discovery process. In the process, we kill some molecules, of course, so that the best survives.
Yeah, I see the joy in your eyes when you say kill molecule. There's something about that.
Killing molecules is good. Killing people is bad.
But that whole idea of fail fast, like you don't want to fail. Yes, you want to fail, and you want to fail quickly. Yeah. It's a bit of a double think. And Tripos had that as one of their slogans. I think back in 2000 or 2001, it was a big thing: fail early, fail fast. In the context, sounds right, but if you don't know what that means, it's just, what are these guys on about? You want to fail early and fail fast. So they actually kind of moved the banner, so it wasn't the first thing that people see when they.
Well, it's good. And you had a question about where in the process is this employed? And I was just thinking about, as you were describing it, it's almost like you're helping them. You're building the train track that they're running on, but you're guiding it in a way that everything they build is going to be probably okay, right?
Yeah, you know what? It's a very interesting question. So we start at very early stages, like even when the project is just ideated, right? So this is the target. So when we have a target, we do what we call a target safety review. Mm-hmm. And we as computational chemists, we have a lot to do with the target safety review. We find the nearest neighbors before even any chemotype or any chemistry is done. So we can do that. Mm-hmm. We can always contribute to that. We can also do like the species, what species will be appropriate species, not only for toxicology, but also for efficacy and other things going forward. And also recently, there are recent cases where computational chemists working in toxicology can contribute to submission and very late stage during IND submission. We actually can contribute
FDA
to that.
submission.
Yes.
In what way?
Yes, that's a fantastic question. So when we discover biologics, so an antibody, for example, needs to be cross-reactive. Otherwise, how will you do a pharmacology studies, right? So, for example, an antibody has to cross-react with human, has to cross-react with cyno, has to cross-react with rats, or, you name it. So sometimes our discovery towards developing our biologics is driven by how cross-reactive it is rather than how potent or efficacious it is against human. So what we can do in this aspects are like how different are the cyno epitopes compared to human? How different are the dog epitope compared to human? And is cross-reactivity costing us some kind of efficacy, So we can do that. And based on this kind of approaches, what we can do, we can send a package to FDA saying we do not need a GLP tox study because it is irrelevant. The cyno epitope and the human epitope are so different. If we do a cyno study, tox study, it will not make any sense. So we can do an in vitro only package where computational chemistry data is one of the aspect in that package. So that is how we.
And I'm guessing that speeds things up quite significantly, right?
I mean, not only speeds things up, it also saves a lot of money.
Yeah, for sure.
It's actually, to a certain extent, a bit surprised that they accept that, because they're usually sticklers for these kind of things, But you're saying they're confident enough in your predictions that, look, this epitope is so dissimilar in this other species, any studies we do in it are going to be irrelevant.
Yeah. I'm sure it's a pretty detailed format that you have to adhere to for the FDA.
It's so much different than what we do in discovery stages. We have to document everything. We have to, do a QC of that, and that
must be GMP, GLP compliant, etc.
Well, I hope Mo is a GMP, GLP compliant software, but it is not. So we have to be as documented and
on the documentation side, I mean, for sure,
as possible.
Yeah, it's good.
We have done it very few times, but we have done it already.
That's cool. So clearly the kids at home are listening to this, and they're like, this Arijit kid seems really cool. Like, how do I become a molecular assassin? So how did you become a molecular assassin? Take us back. How did you get into the field? What did you do for your undergraduate studies?
Yeah, so in my undergrad studies, I studied pharmacy, and then I did a master's in pharmaceutical chemistry. And my PhD was in medicinal chemistry. I did all my studies in India.
Okay.
And during my medicinal chemistry studies, what I did, I used tripos, as you said, and we use molecular dynamics, we use molecular docking, being a medicinal chemist. And then I was kind of drawn towards the computational chemistry aspect of medicinal chemistry, drug discovery. Then I was an assistant professor in India, and I had a corner of a lab, and I had PhD students and master students. And then I got an offer for a sabbatical in Israel. So I went to Israel, and in Israel I heard a lecture in 2013 I went to Israel. So 2013 is when Michael Levitt, Arya Warshel, and they got the Nobel Prize for developing the force field, basically. And so I listened to their lecture, and that moment I was sure that I want to be a computational chemist going forward. So
I didn't mean to drop you. So you already had one toe in the water, right? Like you'd done this before. Were you doing it routinely in your lab? Your students were doing it.
Yeah.
And then you heard these folks in Israel, and you were like, "That's it.
That's it. I'm going to be a computational chemist. That is what I'm going to do." And then I did a lot of that time machine learning, which is an algorithm that was developed by my previous supervisor. His name is Amiram Goldblum, called iterative stochastic elimination. It's like an optimization algorithm. And after that, I came to MIT in Bob Langer's lab, where I was responsible for developing receptors, discovering receptors instead of discovering ligands that can bind to glucose. And it was awfully challenging project, which we were not successful. But what happened is I learned a lot. So the learning curve there was so steep. And
would you mind just telling us about Professor Langer's laboratory? Because it's a pretty unique place, and it has a very, very important role in the biotech space. So could you tell us a little bit about that?
Yeah.
And how did you connect to that group? How did you connect to Professor Langer?
Yeah. So when I was in Israel, my supervisor, I worked with two supervisors, one in an experimental lab and one in a computational lab. And my experimental supervisor, Professor Avi Dom, he was a previous Langer alumni. And
of which there is a very, very connected network of people, right?
So I told Avi, you know what? I had a job in India. I want to go back. But if you can ask Bob if he's willing to take me, then I'm going to leave my job and go to Bob. So, things work out, and I went to Bob's lab initially to do some lipid chemistry and lipid RNA modeling. And then we have this project by Novo Nordisk. That is what I ended up doing. When I went to Bob's lab, it is like a huge biotech kind of lab. It's like 130, 150 people lab. And it takes a while to understand like the hierarchy of the lab and everything. So it's an overwhelming experience initially. And then Bob was really, really kind and supportive to whatever we wanted to do. We can do as many crazy stuff as possible. Budget was good, so it was a fantastic experience. And whoever is in Bob's lab had like a different kind of experience that is like so much different than other academic lab.
Yeah.
And Bob is, as you know, is a pioneer in the Cambridge biotech ecosystem that we have today.
Yeah.
So he's one of the pioneer of and possibly a great responsibility goes to him that the Cambridge bio ecosystem is there today.
Yeah, that was awesome. And how long are you in Professor Langer's lab for?
I was there 3 years.
3 years.
Exactly 3 years.
So 2013 to 2016, or was it slightly after?
No, 2016 to 2019.
2016 to 2019.
Yeah. And then I met, so in 2018, I was like applying for academic jobs. I never thought that I'm going to go to an industry. And in academic jobs, I was applying and got some interviews and everything.
Was that in the US or was that
in the
elsewhere?
US? Yeah,
okay.
in the US.
Yeah.
And then there was a job posting at Takeda Pharmaceuticals, which says a computational chemist, but a toxicologist. I said, okay, let's see what it is. Then I met Yvonne Dragon, and she told me like how important a computational chemist can be in a drug safety space. And I thought that all these things, all the techniques and all the skills and expertise that is necessary for implementing all this safety by design. So I know all those things. I just need to implement it, right? So then it actually fascinated me a lot because if you're in drug safety, you are thinking about so many different targets at the same time rather than developing a molecule for one target. So we are drug discoverers. We are not molecule binder finder, right? So
molecule binder finder. I love that. We got so many taglines for this episode: molecular assassin, binder finder. I love it. It's brilliant.
So that is what actually fascinated me.
So was there? I didn't mean to interrupt, Chris. I'm sorry. Was there? It sounds like there was a lot of scope for you to bring to bear your vision for this safety by design concept. Is that? Am I right in thinking that?
Yeah. So you are absolutely right. So we needed. So what we needed is a different point of view to how we design out in toxicology space. Most of the design out, don't get me wrong, the design out principles were there, but most of the design out principles that our toxicologists would do that time or previously was mostly ligand based, SAR driven, and there is nothing wrong in that. But how we discover a molecule by solving structures. And so we need to solve structures, or we need to do a structure-based approach to off targets, and that is what I try to implement. And I'm really, really thankful to my employers so that they let me do what I wanted to do, and 5 years, we have achieved something. We have taken at least the first few steps towards that.
I guess because you're working on multiple targets, multiple different information. Some targets have tons of structures, some have none.
Yep.
Some's ligand-based. You get to use all the computational tools at the same time. If you're working on a structure-enabled project with hundreds of structures, you're only doing docking. You're not bothering with ligand-based methods because we have structures. Conversely, a project that has no structures, you're only doing ligand-based. So this way, in a sense, you get to sample all the tools.
We can diversify and use everything that is available to us as a computational chemist. We use molecular docking, we use QSAR, we use machine learning, we use pharmacophore map. We also use some QM where it's needed.
For reactivity, I imagine, for the...
You talked about this with the Herc prediction, right?
Yep. So today, for example, for the Herc prediction, so we had to do QM because so much electronics is involved in that. So whatever gets the job done, we do it. So whatever computational chemistry aspects, things we need, we do it.
That's good. And do you have how do you bring this? You started off. Maybe before we get into that, could you give us a 5-minute overview of your or a 2-minute overview of your presentation today? Because you gave a phenomenal presentation.
Oh, thank you. So what I talked today about is how important is safety in drug discovery, And as a medicinal chemist or a computational chemist, we should always incorporate safety when we discover molecules, because at the end of the day, we are discovering a drug that is going to be administered to someone I know, right? So it has to be efficacious and it has to be safe, and that is how we get the edge, right? And so today's talk, I focused on how important safety is and how we kind of try to design out at the very early stages during the molecular discovery, not to discover a molecule and then say, oh, what we are going to do with safety. So we try to incorporate safety in the chemistry of the molecule itself, not to do a damage control afterwards. So that is some kind of an abstract from my presentation, if I may say.
Well, since from what I understood was that, let's say you're starting in a new chemical space and you got some new series, and you've got a certain target, but you know that target off-target effects are these known proteins. So you're going to make sure that new chemical series isn't automatically going to hit those, or if there's any information on that, you say this new chemical series, well, these are known to hit these off targets. Don't make those kind of substituents. So I guess you're kind of looking at what's known information. If I'm going into a certain core, but I know if I put a group over there with a core, it creates a toxic metabolite from some other study somewhere that you're not considering when you're trying to find the binder,
Yeah, definitely. So we have to think, if we are a drug discoverer, we have to think in every direction possible, not only the efficacy and potency, right? So we have to think about, as you said, a reactive metabolite, for example, which I have not talked in today, but that is a very, very, very important aspect. And reactive metabolite still today is done in a very generic way, see the structure and see the alerts, right? But there are so many things we can do as a computational chemist in that. And so, I don't want to open that can of worms, but that is like something definitely we look at.
Yeah, I imagine that can be very hard too, because there's something like a chlorine mustard. It's like a chlorine at the end of an ethyl group, and that's got an ability to come and nucleophilically attack, but you only know that from advanced chemistry, and you can only determine that from a quantum calculation. So it's hard to probably see as you're modifying your molecule and going into a pocket and getting good interaction and maybe getting some even good experimental results. What you're doing is you're producing a toxicophore. And it's becoming central to your series.
Yeah, exactly, and that's exactly right. That's why I quite like the idea that it's an abstraction to a set of features that they add to their MPO business, right? I've got the panel of physicochemical properties that we care about from an efficacy perspective, but I guess what it sounds as if you're really normalizing or encouraging let's not go down that direction, right? Where the thing you're making is inherently going to get kiboshed. Yeah, it's brilliant. That's super.
Yep.
And so in one of your first slides you had, you really talked about you go into a room and you're like, hi, I'm Arijit, I'm the molecular assassin, and all the medicinal chemists give you the stink eye and walk away, right? So, but the first graphic you had and the way you introduced it was you go out, you shake people's hands, you have coffee with people, you tell them what you're up to, right? So how important is that part of the role in making sure they understand that you're not there to poo-poo, but you are there to guide, to make sure that this is kind of sustainable?
I mean, medicinal chemists do understand that we are very important. So, it is... They do not want their molecule to fail because of toxicity, right? If they get a support by someone who understands toxicity and understands some chemistry, they will always use that support, right? So that is what we need to kind of convey the medicinal chemists, that we are your support functions. We are not like, we don't want to kill a molecule for no reason. So that is where we had amazing relationship with medicinal chemists and the computational chemists on the project. And there are examples where we design on target and off target together in a concomitantly together. So medicinal chemists are, at least in my company, they are we have an amazing working relationship, and we work together all the time.
That's good. So it should be.
I mean, you probably learn a lot of things from them too, because there's just this historical knowledge, and they'll know about a certain group. Well, this is gonna makes a 5-6 ring, which can actually open up, and that happens, and then it tautomerizes, and this other rearrangement happens, and then you get your toxic metabolite, or
Yeah, most medicinal chemists do understand about toxic 4. I mean, they know about toxic 4s. What we can do is we also like help them with the models and predictions and computational work, tools, and also in vitro assays. So we do all those things, and for one chemist, it's very difficult to do an SAR for their on target and then 10 other off target, right? So that is what we provide, the off target SAR, and we try to convey the trends, this pharmacophore over here or this functional group over here is likely causing this off target, which is not always intuitive. So that is where the modeling and the structure-based modeling comes into.
And I guess you can sort of build this up over time as you get more and more examples of different off targets and what things look like. There'll be an aspect of discovering new stuff, but an aspect of finding what we already know within our own data.
Yep.
And I mean, that could be challenging too. You've got all kinds of different crystal structures, on targets, off targets, models with known drugs, models with other known drugs, information about toxophores, and just being able to, on a modeling project, looking at something and all of a sudden alerts go off. Okay, now you're starting to look like that type of material. Now you're starting to look like that. So sort of like our structural alerts.
Yeah.
Your log P is getting too big. Your TPSA is getting too small or something like that. You're going to start saying, beep, beep, beep. You've got like Toxicophore, the simple ones, like, nitro groups and things like that, within themselves as tiny groups are toxic. But sometimes something's more toxic in a larger sense because it's also a ligand for that. Yeah. I lived your PDE, for example, that the tick inhibitor was also cross-reacted with PDE4D, right? And you just have to model it in PDE4D. It's like I can add something there, and it's not going to like PDE4D, but it'll still be okay in tick.
Yeah, PDE4. I mean, we have year over year we have off-target of interest. I would say like PDE4 is like for the whole year. PDE for every project you have PDE4 inhibition, right? And then you have HERG. It's like. So many projects have HERG, and sometimes we do not understand. Some neutral molecules also bind to HERG. And you also have like some ion channel problem, like sodium 1.5 ion channel or other ion channel. We have like some of the GPCRs sometimes show up. So it is an ongoing kind of, and we have to be on top of this off-target designing out kind of exercise. Sometimes for non-kinase project we see so many kinase hits, and then so many interesting things that we can do as a computational chemist contributing in toxicology. So that is what fascinates me in this, and I think we need more chemists who will be doing computational toxicology kind of work.
Well, you think actually like practicing medicinal chemists getting more into the modeling, and you think that'll be of benefit?
Medicinal chemists nowadays do modeling, many of them.
For sure, but I usually think of them doing modeling in the context of, say, structure-based drug design, which is a very natural place for med chemists to do it. But I guess maybe what you're suggesting, correct me if I'm wrong, is that you're modeling against target X, but now and in Mo we have different members of family X you can compare to, but you might say at a certain point, oh, your molecule looks like that. You might want to also dock in these 3, 4, 5 off targets. You provide that package for them without them having to figure that out for themselves a bit, and some sort of pre-result in some ways that they get a warning. Oh, maybe go check your molecule in PDE4, and here's how you go do it.
So we have that kind of platform. Where we have both like machine learning models, we have QSAR models, we have pharmacophore, with not like always open to medicinal chemists to use. Sometimes we use the pharmacophore and say that these are the pharmacophores. And also we have structure-based models, like for PDE4 we have for HERG, we have for NAV 1.5, we have so many others that is there for the chemists to kind of dock their molecule against. And docking is docking, right? It's not always gives you the right, insight that you need, but it is there. Yeah. I mean, and then you have to tweak accordingly and make the models more local than, according to the project.
Did you build the platform as part of your role?
Yeah,
you did.
I do build the platform and deploy it so that the chemists can use it.
That's good. And is it? I mean, how do you take all that data and combine it in a way that doesn't overwhelm them? Is it project specific? So if you're working on a certain project, you get a subset of certain things that you know are important, or do they get access to absolutely everything and they have to triage?
No, we actually kind of we work with the medicinal chemists and especially with the computational chemists on the project, and discuss like what we should be exposing to the chemists to aid their design, and what are the theoretical data that actually help to get the model, but not will help in future design, right? So we kind of discuss always, and we always tweak it whatever is needed, and that is how we kind of deploy it. So yeah.
So you provide like an interface, a web interface, or
Yeah.
sort of like a suite of applications, and
Yes.
basically certain buttons are enabled or not enabled depending on what they can do.
Not always. Sometimes this is for a project that has matured quite enough in a lead optimization to lead identification to optimization stages. So when the chemotypes are just starting, and then we focus on making a local model. So what sometimes we do is we get the list of molecules, we do our computational modeling, and then we convey. Once we see there is a confidence in doing that, and if we press a button and it will not spit out something really trash, then we deploy it.
Yeah, the validation.
We do not deploy it right. Like
So you're sort of like the computational informatic gatekeepers.
Yeah.
In the sense of you're going to get the stuff that we validate, which makes sense.
Yeah,
right? You want to
exactly.
give a person a tool that's going to help them with some insight, but it's very easy that this Docker is going to put things in the wrong place and guide people the wrong way. You're just there to say, yes, this information could be useful, but I'm going to interrogate it beforehand so you can be confident at least what I'm giving you is probably reasonable.
Yeah, that's good. So you've been in industry now for
5 years.
5 years. Any regrets on leaving academia? Do you still dabble in academic stuff, or?
Yeah, I love academia. To be honest with you, I miss the teaching. I miss publishing papers. But I think the industry is you are more close to drug discovery, as close as possible. So that is the aspect I really love. I cannot imagine being in academia and doing only computational toxicology for a living, right? So that is an aspect of industry I really love. However, I miss the teaching and the paper publishing aspect.
Yeah.
Well, you must get a bit of a teaching aspect in part of the deployment, in the sense that do you create educational material and have sort of like we do in CCG, we take workshops and we do a lot of teaching in our job at the end of the day. But you must do that too to explain to chemists the limitations of these methods and things like that.
We do that, but teaching undergrad.
You're right. Teaching a young, fresh mind as opposed to an old, not so fresh mind.
I didn't say that.
I know.
Arjit's on the record as not having said that, so that's good.
Yeah, they were like, I've taught at many different levels. I've taught at CEGEP, I've taught at high school, I've taught at places where they don't want to be taught. But there is something special about college students where everything you're saying is something brand new for them. And but teaching experienced med chemists is nice because they got a lot of knowledge. But it's hard to surprise them.
Yeah.
So you tell them something, it's I know that.
I know that.
So you miss that kind of bringing joy to people's eyes, I imagine.
Yeah, especially undergrad teaching, because they're like sponge, right?
Yeah.
So you can teach a lot of things to them, and luckily, so many of my students whom I have taught, undergrads, they are doing fantastic in industry in the US and also in academia. I'm so proud of them. So some of my students are in Cambridge working in companies out there. So
do you go out and have drinks with them?
Sometimes we have like one of my student came to visit me, and we sometimes not that often, but well,
enough that it's kind of cool, there's a student and he was a student back in India. Right. So now you're both working in Cambridge, Massachusetts, and you're
that really fascinates me that I taught these students when they were in first year of their undergrad or second year of their undergrad, and they are like now professionals. And I mean, I hope I taught them something. So
we're sure you did. Yes. That's great. So you think industry is it? You're gonna keep on. You're gonna.
Yeah.
Your guild of molecular assassins is your people, and you're gonna keep on keeping on.
Yeah, I plan on keep doing this.
That's awesome.
I mean, is there a community forming of that? Like, we have communities that do docking, communities that do FEP, and it's sort of focused on different aspects of computational chemistry.
Yeah.
But is there room for like a toxicology conference with your kind of approach? Is it?
I mean, not really. I mean, there are computational toxicologists in the industry, of course, but they are mostly machine learning focused and rather than structure-based focused. And,
well, yeah, I guess that's what I'm saying. Maybe there is kind of a sort of a hybrid field, because we think of toxicology as very almost cheminformatics. Like I say, it's all going to be QSAR, machine learning, 2D descriptors, no structural stuff. And there's this big divide. Then they go to drug discovery, where it's all 3D structural stuff, and bridging this gap in some ways.
Yeah, so we need more people there. We don't have a community yet. We need more people there.
Okay.
We need young computational chemists who take up this.
Take this mantle, right? This.
Yeah, well, I mean, hopefully we know at least one person listens to this show, so maybe that person can share it with a friend, and then there'll be two, and that person will be a computational toxicologist. They'll be like, hey, that's my person. That's awesome. Yeah, it's good.
I mean, do you know of counterparts at other companies and
exactly? Yeah, there must be. Who are the users at other places?
Yeah, I think there are, but yeah, we are not like having like a community as we have in drug discovery, ComChems, right? So. Yeah, but there is definitely.
You could put out a call, right? Go to the ACS, have a little session at the ACS on computational toxicology.
There is a chemical research in toxicology. ACS.
Yeah.
Well, I mean, and
a comp
is
thing
it
one.
diverse? Because some of the criticisms of the ACS is that it's a bit diverse and maybe not industrially oriented in some cases. So you're maybe not getting the more.
Oh, it's more academic focused, so there's less maybe.
Yeah, and back to your Arjit's point, the thing when you're working in academia, you can work on one problem in isolation from the rest of the universe, right? When you're working on a drug discovery project in industry, like millions of dollars on the line, they actually need answers, and you can't have the luxury of, working on your project until it works. No, I have to make this thing work right now, and using whatever method you can, your slide said it, we use whatever we got in the toolbox, whatever we think will work, and having that kind of approach in toxicology, it's kind of already there in drug discovery. Yeah. Like a drug discovery, if they want to dock, they'll dock, but they'll use whatever tool they can. And some people have all the software, right? But that same sort of, combined approach in toxicology maybe is only just starting to form, and maybe you're one of the people forming that.
In designing out, yes. But computational toxicology is a huge field, and it has been there for a long time. If you go to Society of Toxicology meeting, and so there is a computational toxicology, totally dedicated session for that. But those are mostly for, ICHM7, which is basically impurities and all others like prediction of mutagenicity at the later stages. And also the computational toxicology is generating, hypotheses from the biological data and all those things. It's not it is not that rampant like molecular designing as a computational toxicologist, field. So that is something that niche is not there. Other than that, the computational toxicology is a huge field.
Yeah, but what you just described is a bit further downstream. Where again, I come back to this. You're really helping them build the railroad in a way that's guiding them.
So we toxicologists need to have a say in molecular design. That's what I wanted to say. That's it.
That's perfect.
Yeah, and I think actually you had that in one slide too. Is before you've got a panel of molecules, and you pick the ones that aren't toxic based on the molecule. Right, and I guess that's kind of what I understand in computational toxicology traditionally. It's also to deal with EPA and things like that. There's industrial chemicals, and it's much wider than drug discovery. And you might not even necessarily be interested so much in the exact mechanism, because you're not going to design this molecule. You just want to give it a check mark or an X.
Yeah.
Right. But what you're doing is the molecule is not there, I want to actually design it so it has a check mark and not an X, which is something traditionally not done in that field. So it's the designing out of the designing out of toxicology, as opposed to here's a molecule, because there are great machine learning models for toxic molecules, but I think they get kind of this generic toxicity. Like, if you want to, for lack of a better word, there's certain functional groups that are just hit everything. There's like these ones that metabolites, they just, break everything. But there's certain things that are toxic because they act like a drug on the wrong target. They're not chemically bad other than that. They just have a magical key, as opposed to being just a, reactive nucleophilic, destroying entity, which is what we think of a lot of times in toxic molecules. It's just being chemically liable and so pan-toxicity, as opposed to...
You're spot on. I mean, I don't know what to add on this. Like, you have already answered the question.
Well, I'm happy I at least understood what was going on.
I think we just said back to you what you said to us, though. I think that's good, right? We understand what you're doing.
I think you're right. Computational toxicology has been there forever.
Yeah.
There's always been something a little bit adjunct to what I do in drug discovery. It's got similar things, QSAR, regression models, but I think the people more interested in are the people trying to deal with these hundreds of new industrial chemicals that are coming out every year, and we can't really do all the studies on them, so we try and... But they're not employing so many drug discovery strategies, and becoming the drug discovery aspect of toxicology is kind of what you're...
Historically, the toxic molecules are molecules that look scary on paper, right? So, for example, you talked about nitrogen mustard, right? So they will have a reactive group, and they are pan-toxic, as you said. But there are molecules that look exactly like a drug. Their applicability domain is exactly drug-like.
Yeah.
And they bind to off targets, and they bind to targets that you don't want, and they cause toxicity.
Yeah.
How do you deal with them?
Well, that's I think is kind of the frontier you're trying to explore, right?
Exactly.
In a sense, like there's obviously toxic, non-toxic. Then there are drug molecules that would actually be an awesome drug if that protein didn't do what it did. If it did something else, that toxic molecule might be a good drug. It just happens when you hit that target, you get this bad effect.
I gave an example of Ducra, right, today in my talk about TYK2 inhibitor, and during the discovery, BMS felt that they saw that it is binding to PDE4, and they definitely have tried all sorts of designing out strategies that are out there. Eventually, they solved the structure.
Yeah.
Right. So that is what actually got them where they are.
Yeah.
So that is.
And how recent is that work?
Oh, I forgot. Ducra is actually in the market now, so it has already. So I don't remember the exact date, but it is there on my slide. But 279 is very recent. And Nimbus also use the same principle, and they use actually the crystal structure of BMS to solve this problem.
Yeah. So we'll probably see more and more papers like that, I think, where people...
Yeah, there are definitely.
Yeah. Well, it has to work backwards, right? We have to bring it closer and closer and closer, so it's no longer a concern, or we minimize that concern in the way that you're trying to do.
Yeah. I mean, we did this with properties, right? Like log P, molecular weight.
Yep.
It's just a more sophisticated form of filter.
1,000%, yep.
Yeah, I remember there were times like, we have the molecule that binds to the target very nicely. What we have a problem is with the MPK, right? So we have the PK problem. And we kind of know like now, right, what are the things that we need to do for PK problem?
Yeah.
So same with safety, right? So
I think the toxicity has so many more mechanisms. I think that it's of the ADMET, it's the hardest one in some ways, because there's so many different pathways with which something could be toxic, right? Whereas properties are kind of too greasy. Are you too polar? Or are you too greasy? Or too big, too small? But these other things can. These funny metabolites that form, that's sort of like what organic chemistry. Like all molecules look the same except that one, because it's got enough carbons to make that ring system that now allows it to rearrange, and something funny happens that you wouldn't predict with all the other analogs.
Well, CYP450 is one of the fascinating. This is one of the enzymes that metabolize the xenobiotics, right? So this is one of the fascinating enzymes that is like we're still understanding. We are not there like even 10-20% of understanding that is why we get surprised all the time about how a drug is metabolized, and if that metabolism is going to cause some kind of liver damage. Yeah. Because drug-induced liver injury is most of the time very rare, and sometimes we don't catch it in the preclinical species toxicity study. Also, sometimes we don't catch it in phase 1 or all the clinical studies, because it's 1 in 100,000 sometimes. But 1 in 100,000 can be a lot for that person who is not a statistics, right? So it's just idiosyncratic in that sense. So this is so difficult to catch. So metabolite, reactive metabolite, chemical structure, alert, these are like totally a separate aspect of toxicology, computational toxicology, that needs a special attention. And
I guess starting with the CYP structures, figure out where the points of metabolism are, figure out which would be the most likely metabolites, and then figure out to what extent would that metabolite cause liver damage.
I remember I worked with Mike Drummond on CYP, and so it was really fantastic collaboration to work with Mike on this.
He had like sort of a very simple sort of half pharmacophore, half docking sort of CYP model.
It's an ensemble docking based approach, and it's not an ensemble docking. I'll say it's an ensemble pharmacophore based approach with the ensembled structures that are out there. But we are limited to in structural biology, right? So CYP pocket is so huge, and it's like has such a huge movement, right? So we need more structural biology in that space.
Our guest yesterday was a structural biologist. We should have hammered that home.
I like the side with the structural biologist as the father holding the computational chemist with the 3-year-old child up over the wall. That was good.
I think we at computational chemists are actually so much dependent on structural biology.
Oh yeah, 100%.
100%.
Yeah, that's right.
I think we have to have a father-son kind of relationship, right?
Yeah, definitely. Thanks for being here, Arjit. That was a great discussion.
Yeah, excellent. Thank you.
We're looking forward to hear more of this computational toxicology from the drug discovery perspective.
My pleasure.
Because I think with more crystal structures, more organisms, that kind of stuff, pharmacophore type models, it'll be quite interesting to get into.
Yep.
Definitely.
Good.
We are continuously working on it, and thanks to CCG for having me for this podcast, right? So, thank you, Chris.
Yep. We'll be hearing from you again sometime. And look, everyone, have a good day and stay safe. Thanks for listening to this week's episode of Under the Surface. Don't forget to subscribe to our podcast on Apple Podcasts, Spotify, and other platforms so you don't miss an upcoming episode. Enjoying our podcast? Please rate and review us on Apple Podcasts and Spotify. Have topics or speaker suggestions for future episodes? Send an email to podcast@chemcomp.com. That's podcast@chemcomp.com. Until then, keep exploring, keep learning, and keep loving the science. Signing off.